Hello, and welcome to my presentation, An Exploration of Self-Care and Social Workers in the U.S. Virgin Islands. This presentation is from my class in Psych 815, where I will briefly describe my research paper idea and the development of the hypothesis. Hi again, my name is Natalie Lewis. The background and initial literature review. According to Warzonic 2023, social workers can have experiences of high levels of work-related stress, which can then develop into negative effects on their performance on the job and can ultimately cause compassion fatigue. By placing extensive self-care techniques into practice that consists of a plethora of factors to include seeking and participating in therapeutic mental health care, professional boundaries, and self-reflection, this can improve their stress levels. Emerging viewpoints magnify the connection between professional and personal experiences by suggesting that self-care should be seen as a diverse process rather than a fixed group of interventions, according to Bresci and Vaden 2024. Some studies have shown that specific facets of LCSW's jobs place them at risk for burnout, compassion fatigue, as well as secondary traumatic stress disorder, according to these authors, Shepard through He-Wan 2015. Subsequently, a study by Mott and Martin 2019 demonstrated that self-care significantly reduces burnout and secondary traumatic stress while increasing compassion satisfaction, which can lead to development of negative compassion outcomes. Due to the high risk of burnout among social workers, Lee, Miller, and Bride 2020, the significance of self-care in this field is frequently discussed, and self-care must become a priority in the field and in the workplace, according to Miller 2019. The gap consists of studies that have displayed that there's a major disconnect between social workers' awareness and actual use of self-care. A study conducted by Zhang 2023 talked about high turnover rates in this field for a number of issues that included burnout, professional duties, and unreasonable heavy workloads. The problem is that the consistent problem of professional burnout among social workers has significant implications for individual practitioners and client outcomes in terms of functioning, as well as whether or not their organizations will be sustainable, according to Warzonic 2024. Continued, the purpose of this study is to give some necessary understanding into how social workers can begin to place self-care into practice, how often they do it, and how this ultimately affects their own well-being and client progress. Research question is, what is the relationship between reported feelings of stress between social workers who are working in medical, public, and mental health settings, and how often they engage in practices of self-care? The null hypothesis is there is no statistically significant relationship among social workers' experiences of self-care, and this would be assessed by being measured by the self-care assessment worksheet within the U.S. Virgin Islands in areas of all settings therein, to include medical, public, and mental health, etc., and how often they engage in practices of self-care. The alternative hypothesis is the opposite. There is a statistically significant relationship among social workers' experiences of self-care, and this will be assessed again by the self-care assessment worksheet within the U.S. Virgin Islands pertaining to all of these settings. The variables for the study, there will be no use of control variables. The self-care as assessed by the self-care assessment worksheet will be the study's dependent variable. The factors causing stress as determined by the Maslach's burnout inventory will be the study's independent variable. Psychological and biblical foundation. When social work, psychology, and biblical ideas are in the presence of each other, they can present with a holistic way in the understanding of human behavior and providing compassionate treatment. Additionally, social workers are able to recognize that psychological, spiritual, and social issues can be a part of the makeup of an individual's well-being, according to North American Association of Christians in Social Work 2020. In conclusion, thank you for your time and attention to this proposed research study. Social workers are in need of practicing self-care, as their job tasks can be taxing on the mind, body, and spirit. The limitation of this study may pertain to the small sample size that live and work in the U.S. Virgin Islands. The study may need to include other U.S. territories as well. In all things, keep God first, and social workers should remain steadfast in this ideal. We help them, they help others, and in turn, we all serve God. And thank you for your time and attention. Have a great day. Bye.